Now we're looking at tests that we can do if you're suspecting that a patient has what hypermobility issues. So hypermobility just simply means the joints are over flexible. Okay, hypermobility. So there are some one or two tests that you do. So mostly we are just trying to list and pass. Do you understand? So it's later on that we'll still come back to each one of the tests and describe them better. Sorry, let me just put an OTP for something. So let's go. So for the hypermobility, it just refers to an increase in the range of motion in joints, and this is actually beyond, is beyond what is normally there. You understand? So so it could be depicting that there are some connective tissue issues, Ehlers-Danlos issues, Marfan syndrome, any issue that will actually make that your body tissues are too flexible. So common tests that could be done, we have the Beighton Score. Okay, it's a 9-point scoring system. Okay, so they ask you to do all those flexion of little finger if it is more than 90 degrees rather. Okay, then hyperextension of elbows, hyperextension of knees, a lot of things, right? But at the end they'll score you 9 points. Forward flexion of trunk. So all of this, can you say, okay, it's 5 maneuvers. Are you saying this? So this is what we got. Okay, so interpretation is once a person is getting more than 5/9, there's hypermobility. Okay, so little finger 1 point each hand, so left and right. Thumb 1 point each hand, left and right. So at the end is 2 points, 2 points. I don't know if you understand me. So that's how they do the Beighton Score. Then what again? We have the Brighton Criteria. You are combining Beighton Score with some clinical features. Are you seeing some things? Okay, like joint pains, dislocation, soft tissue rheumatism. Okay, so some things that you can also pick up on physical examination. So you use it to now diagnose or confirm that there's joint hypermobility syndrome. Then we have the Hospital Del Mar criteria. This one, we are look at other joints like the shoulder joints, the hip joints, the ankle, the temporomandibular joints. So it's the hyperflexibility getting there. Okay, that's what we're actually trying to look at. So other tests include things like the thumb to forearm test, elbow knee hyperextension test, trunk flexion test. So those are the different tests you use, for testing for joint hypermobility.